I got interested in interstitial cystitis when I was a resident in New York. Dr. Lowell Parsons, who's a big pioneer with interstitial cystitis out of the University of California, San Diego, came to lecture on my residency program. And he said, you need to know interstitial cystitis. You will see this in your career. So I paid attention. And when I was in the Navy, I diagnosed several people. When I came to Georgia Urology, I diagnosed more people. One patient was so appreciative, she became on the Interstitial Cystitis Association physician referral hotline. So anybody within several states away, she said, oh, you got to see Dr. Jeff Proctor for interstitial cystitis. So as I got more patients, I started working with the company that made Elmiron. Back then it was ALSA, and I became a speaker, a national speaker for Elmiron for ALSA, and then I became on their National Physician Advisory Board. So the more I learned about the interstitial cystitis, the more involved I got with it. A lot of doctors, a lot of urologists don't know a lot about it, don't want to deal with it. I guess I have the mindset that I want to help these patients out. Through Dr. Parsons, I learned about the bladder installations. I even went out to San Diego and watched him for a while to learn all about it. And the more installations I did, I saw that it really improved patient care. The only recent medication that's been FDA approved for interstitial cystitis is Elmiron, and it was FDA approved in 1996. Nothing new has come along since then. When you make a patient with interstitial cystitis better, they're very grateful. So I want to do everything I can to help my patients out. And these installations really benefit a good portion of patients with interstitial cystitis. We instill the medicine in the bladder, and they void it out about 30 minutes later. It can really help their pain and urgency. So that's what I'm doing all I can. We're doing 2 studies right now to try and get FDA approved. The FDA wants what's called a component of parts, meaning that all 3 components together work better than each component by itself. Even though each component by itself is FDA approved, all 3 together in the bladder haven't been FDA approved. So that's one study. And the other study is over 2 weeks. They can get installation every other day depending on their symptoms. So they can get up to 6 treatments. But my experience so far, it's been much less than that.